for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gained something from the program that can help you or your loved ones. We're doing things a little bit differently today. A lot of times we'll talk about a specific health topic like a diagnosis, but today we have a special treat. We have Nick Marsico with us. You are a veteran of the show, but it's been a while, and you were in a different role at that time. So thanks for being here.
Thanks for having me.
You got it. Yeah. I think I just want to start, tell us a little bit about you as Nick and how you got here. And
Sure. Well, thank you for that nice introduction. I'm not sure that I've ever been called a special treat before, but I appreciate that. That's a good way to get started. So my name is Nick Marsico. I'm the president and CEO, and I took over when Todd Almendinger retired on October 1st of 2020. So I've been at the hospital for over 15 years now. Okay. I'm a pharmacist by trade, and so I came to the hospital in the director of pharmacy role. Spent a few years in that role and went through some major changes with implementing a new electronic medical record and the fun of going through all of that transition. And then after that, I had an opportunity to be part of the senior leadership team and be the ancillary administrative director. And so I was in that role for a short time, and then I moved on to be the vice president of ancillary services. 2015 became the chief operating officer, and now in 2020 had a chance to go into this role. So a lot of different responsibilities throughout the hospital over that time. It's been wonderful, and I'm having a blast doing it. So obviously, I've been here 15 years, and I don't plan on going anywhere soon. So that's
So you started as in the pharmacy director role. Mm-hmm. Okay. I think that brings up kind of an interesting point. I do also want to ask. You are an artist, you are artistically talented as well, right?
I am. I am. So
more than just your professional background, but you have,
Yeah, no, I love different types of art media and creating, and so actually I went to pharmacy school. Knowing that I wanted to get into healthcare and knowing that I wanted to help folks and help people, and I really liked the aspect of that, but I had an actually opportunity to look at a couple different art schools and decided that art's a great hobby. I want something that I can depend on from a healthcare perspective, and folks always need healthcare. People will always need healthcare, and so from a career choice, I figured that I would be better off going the pharmacy route, the scientific route, and from a healthcare perspective, I looked at a bunch of different opportunities. My science background and chemistry background landed me in I'm a people person. I like to talk to people, I like to see people, and I'm really not into the bodily fluids and gross stuff of a lot of healthcare. So pharmacy was a great role for me, right? Over the years, I've really realized a passion for leadership and team development and coaching and motivation, and I've been lucky enough to be a part of some really good teams and develop some really good teams over the years, and a lot of that has led to opportunities for me to where I'm at right now.
Very cool.
I'm excited to take advantage of that.
Very cool. And I think that brings up another point of, I was going to ask you about careers in healthcare and how they've changed. Used to be, you were a nurse or you were a doctor, and there are so many more aspects to it. But kind of like your path, or even my path, or probably most people's path, you start out here, and then I didn't even know this was an opportunity. So, talk about some of the career opportunities, or if somebody's looking into healthcare, what would be some?
No, absolutely. So, as I said before, people always need healthcare. Right? That's one thing that we've learned over the course of 2020 is the term essential employee. And there are certain things that are always going to be essential. People always need shelter, they always need food, and they always need health care. And so when we look at that, it's a great field to go into. We're in a shortage right now of a lot of different professions in the healthcare field. Nursing is one of those shortages that we have. So the RNs or BSNs, the bachelors of nursing. Primary care physicians are shortage as well. There's a big need for the advanced practitioner role, and so those are like the nurse practitioners or
Right.
the physician assistants.
Okay.
There's a big need for those and a shortage right now, but also there's a lot of other areas that we need help with. When you look at the technology side of things, we talked about the transition that was part of to the electronic medical record.
Yeah.
The amount of folks on our healthcare technology team have quadrupled since I started at the hospital, and so it's not going to change anytime soon. And we all live with technology all day long, and so in healthcare it's just as important. Speaking of technology, one of the emerging fields that's becoming more and more important is the safety and security of that technology and information. So cybersecurity as well in healthcare. The people's healthcare information right now is actually worth more in the black market than just basic Social Security numbers and some of the banking numbers at this point. So there's a big need from that safety and security side of things too. So that's kind of the transitions that I've seen over the years, moving more into the technology. But we'll always need clinical folks to take care of patients and patient care. One thing so I started out of college working for a retail pharmacy chain, and I managed a retail store for about 10 years before I came to Magruder. And the customer service aspect of healthcare from a retail side is finally becoming front and center on the hospital side too.
Sure.
And so understanding that and the personality of folks when they want to have a caregiver and a clinician, that it's also a service-based industry.
Very much,
and there's a lot of healthcare institutions out there, and people can choose where they want to go. And a lot of times, they're getting sent one way or another because of maybe an insurance plan or whatever. But we want to make sure that we provide that best service to the community, and customer service is just as important as the quality of the clinical care that you get to. So if somebody's looking to get into healthcare and they have one of those personalities and understands retail and customer service and wants to get in the clinical role, I think it'd be wonderful. We can use all the help we can get.
Yeah.
Right.
And there's, even things, billing and insurance, you need people who understand that world, which is a whole other world. Medical record, And
it's become very complicated
Yes.
with the advent of the insurance plans and the third-party payers. We have to register the information of the patients that get in, and registration used to be a fairly simple task, and now it's a very, very difficult one because of the complexity of the insurance plans. And with an electronic medical record, everything starts with the accuracy of that registration. And so if we don't get the registration right, then we don't get the billing right, we don't get the medical record right, and so on and so forth. So there's a lot of help. And one of the things that we've struggled with, and a lot of hospitals have struggled with, is even having housekeeping staff. And making sure, with the global pandemic that went on and is still going on, and the fact that we are so focused on our own health and healthcare and keeping things clean and sanitizing and hand sanitizing, the housekeepers play a huge role, and that support staff is just extremely important to what we do. And if we, with the amount of volume coming through the hospitals now, if we can't turn those rooms over in a very efficient way, but also in the best sanitized way, in the quality way, then that puts people at risk. So that's one thing I like about healthcare, is that it's very meaningful work. It's worthwhile work, and it's nice when we get those letters and those compliments from people, and they're very excited for the service and the experience they get. But also, providing that service to them really kind of makes you feel great about what you do.
Yeah. I was going to ask you about how things have changed in the last 15 years that you've been at Magruder in healthcare, but even before that. And you just mentioned a couple of them, like insurance has just completely changed things, technology, but maybe talk a little bit more about other things that have just kind of switched how we do things, or really impacted.
There's certainly been a bigger focus in the last few years, probably the last 10 years, on wellness and understanding. We used to work really strongly on how to treat people when they're sick, and we still do, and we know that.
Sure.
But now there's been a bigger push to maybe prevent illness a little bit more, and so from the wellness side of things. So, we're looking at getting more engaged in the community, bringing healthcare to people where they are, and where they can get that in the home. So that's one thing that's changed as well. I will say Amazon here. That's the Amazon effect. People can get anything delivered within a couple of days and get it in their house. And so why not consume healthcare that way too? So how people consume healthcare has changed, and it keeps changing for us. That's a big part of it as well. So.
Yeah, and you also mentioned nurse practitioner, like from that aspect that there's just a variety of different providers of healthcare now.
So we've kind of gotten into a bit of a, I don't want to say situation, but there's a lot of specialty providers. And so primary care, the folks that are generalists, the folks that take care of the family practice folks, there's not a lot of those, and so we've been able to backfill some of that with the nurse practitioners and the physician assistants role on that generalist role, and we still need physicians and providers and those folks, but a lot of that's come about because of the amount of specialties that we have. It used to be that your family doc, right, took care of you, and they took care of your whole family, and then if you were admitted to the hospital, the family doc would come follow you in the hospital and perform all the hospital medicine too. And then now that it changed that you would have certain specialties, so now we send people to a cardiologist or an endocrinologist or an orthopedic, specialist, and so you have different specialties you send folks to, and we have specialties that are working inside the hospital now. So a hospitalist or an intensivist that takes care of the ICU type patients as well. So we've created a lot more specialty services, which is really increase the level and quality of the care that we give, but it's also created a much bigger need to fill the spots of the generalist roles as well. I mean, the primary care provider is keenly important to everyone's health care because they're the quarterback. They see everything. They know what's going on. They care for the patient. They organize all of that. And so that's probably another role that's changed too, is the emergence of patient care advocates, so forth. And so you look at these advocates, and those could be a caregiver. It could be like an adult that takes care of their parent. And my parents are in their 70s, and so kind of navigating them and my in-laws through their health care and becoming that patient advocate for them. And some of those folks don't have those, and so we're looking to provide that service, and other healthcare providers to provide an advocacy type of service just to help people navigate. You do a bunch of work with the insurance side of things and trying to navigate people through the different Medicare plans, and there's 30 or 40 different plans that are available, and now with the marketplace out there, and it's just there's a lot of different options, and people are confused, and so that advocacy role has changed a lot as well.
Yeah. So the big question, the pandemic, COVID, for the last year, a little bit over a year now as we're recording this, it's been like all hands on deck kind of, handling that, and still, what's it been like? Is there a light at the end of the tunnel?
Well, I think everybody's pretty aware that it's been pretty crazy of what's gone on with all of this. Nobody knew what to expect in the beginning. So a year ago, I was at the American Hospital Association convention on February 1st. And we were following this very closely. And then Ohio got their first case on March 9th. And we put our incident command team together that day. And we've been meeting almost daily ever since. And so, when you talk about a giant pause on normal operations, we scrambled at first. If anybody remembers, we were kind of told to expect the worst on a potential surge that came in that April timeframe, and if we didn't, kind of shut down the economy and everybody start masking in the public, we could, have a disastrous tune to the fact that our 25-bed hospital was probably going to have to take upwards of 80 patients at a time, and so when we're used to caring for 25 and we have to move to 80, right? That's a big deal, right? That's
Not just in space, but in
in caregivers as well. So we did a tremendous amount of work to set up an alternate care site in our physical therapy area downstairs in the hospital, and we created a bunch of negative pressure rooms, which are needed for the respiratory illness that we're going on with this. And we were able to pivot. We were able to put a bunch of changes in place. We added telehealth options for our providers. We added telehealth options for our emergency room and urgent care. We were able to develop a respiratory-only urgent care center and section off folks a section of an area that was just dedicated to COVID. We opened up a COVID testing facility. We've done a tremendous amount of work with all of this. But yes, as the light at the end of the tunnel, I think so. If you look at some of the projections and the predictions coming by summer, we're on a downward trend right now, and that's looking to continue. Hopefully, the new variants don't cause too much of an issue. I think that the speediness of the vaccinations will help that tremendously. So, we're doing everything we can to get those vaccines out as quick as possible. There's just a limited supply right now, and when you look at Ohio getting 150,000 vaccines as of this week, but we have 11 million people that need it, and that's a long time.
Do the math.
To get those folks vaccinated that need it. So we're getting there. There's some promise with the new vaccines that are coming out. We have the 2 right now. Johnson & Johnson is scheduled to be the 3rd. They might be able to provide some more doses and might be able to double Ohio's amount of vaccines, probably by the end of March, so 6-7 weeks from now. So we're getting there. But like anything, it's a process, and trying to be patient in the face of a pandemic is very difficult, and it's scary for a lot of folks.
Yeah. Well, and that was the period. I mean, that's when you transitioned into the. So much for just a nice, gentle transition into normal operations.
Yeah, it has been. But I'll tell you what, we have a tremendous team. I'm so proud of the people that I work with, and we're getting so many compliments from the community, and we're really here to provide a service for the community. And we're a community hospital, and we want everyone to invest in us, and we want everyone to know that we're invested in them. And so everything that we did, certainly wasn't easy for us to do, but we did it for the purpose of being able to serve the patients in Ottawa County and those folks that are coming in that live with us and our friends and neighbors in a small community. And that's really what we're here for, and we want to be here for those folks. So, it was, again, when we talk back to healthcare in general, it's worthwhile work. It really makes you feel good about helping folks around you, and that's what we're here for.
Yeah, and all that while people are still getting strep throat and kidney stones and all that kind of stuff. So
so we shut down elective surgeries for a while because we had to conserve the PPE, the personal protective equipment. We're doing pretty well with that right now. So we're still, those are back open. But yes, we are still caring for every other bit of sickness and illness and injuries and so forth that are going on.
Yeah. Awesome. All right. Any last minute thoughts? We're about to wrap up. You got any I wish people knew thoughts?
No, back to, the pandemic is what's on everybody's mind right now, and so it's timely for this. But I appreciate the support of the community. We're trying to communicate as much as we can about what we know. We certainly believe in honest, open, transparent communication, and we will work together with our partners at the Ottawa County Health Department and other partners and healthcare partners in the area. We have a really good team. I'm proud of the staff that we have, but I'm proud of the relationships we have with the other healthcare providers in and around the area too. And again, we're doing everything that we can to help care for this community, and we're very proud of the work that we've been able to do for that. So I just want to say thank you to the community. So thank you all. Appreciate the support.
That's right. It comes from everybody, let me tell you. Yeah. Awesome. Thank you very much.
Thank you.
All right, we are done meeting Nick. And I always say if you have questions about anything we've talked about, or if you have suggestions for a future episode, you can always reach me at Magruder Hospital. You can also reach Mrs. Pells here at Port Clinton City Schools. Don't hesitate to reach out if you have questions, and as always, be sure to share the information with friends and family if you think it might help them. And until we meet again, I encourage you to make time for health.